Makayla Mantla never thought that she would be a nurse, but now she's in her fourth year of nursing studies at the University of Alberta, and she was personally selected to be part of a national advisory committee on Indigenous nursing and health. How did you become interested initially in nursing?
I remember growing up in the Northwest Territories, and I was surrounded by poverty. I was surrounded by people never leaving the community or getting an education. So I grew up feeling really embarrassed and ashamed to be who I am, and I couldn't be proud. And I never imagined I would get into nursing until my mindset shifted where, you know what, I'm Indigenous, I'm proud to be who I am, and I want to help motivate other Indigenous people to get an education.
And what were some of the experiences and impressions that you had of the healthcare system growing up?
I know my personal parents, they had mistrust with the healthcare system, and I never understood until now, where now I'm at the U of A hospital or different hospitals in Edmonton, I see mistreatment of Indigenous patients, and I relate it to what my parents have experienced or have yet to share.
Now, the president of the Canadian Federation of Nursing, or Nurses Unions rather, chose you for the group's National Indigenous Nursing Committee. How did that come up?
I remember Linda from CFNU, she saw me speak, and from that experience, she selected me to come to Niagara Falls for that apology. And that was beautiful because I've never seen an apology firsthand for reconciliation. And I cried when I heard it because I realized that me being an Indigenous nursing student is so important. And the role I have to inspire that next generation to make them believe that you're smart, you're capable, you're Indigenous, you belong here, you deserve to be here.
And what has that opportunity meant for you to sit on this panel and speak about these issues?
Having this experience was so wonderful because I've never seen an apology firsthand, but also to see that, yes, reconciliation, it's a long journey. And, we might not be able to reach that to the end, but I think the most important thing is that we are doing this. We're making the apology, and hopefully other organizations, nursing or not, will follow through one day.
Now, outside of the classroom, you've had some experiences that have really driven home the importance of representation in nursing. I'm thinking, what has it been like when you've done things like placements?
When I've done nursing placements, I realized that I always like to go, every hospital I've been to, I always like to ask the staff, how many Indigenous staff do you have? And I just, out of curiosity, but also to raise awareness, it's always been not that many. Even at the U of A hospital in the surgery unit, I asked the staff, they said they don't have any. And then they thought, maybe one person in 10 years. And even when I meet Indigenous patients, if they're not directly my patient, I would love to introduce myself to them and ask them, are you okay? Do you need anything? How's your treatment been? And just to acknowledge that there is an Indigenous person here to help you.
And that representation matters so much. What are your plans then after graduation? Are you going to set up your own practice or perhaps even continue your studies? Do you have plans to go back to the Betchako community in Northwest Territories?
I know when I graduate nursing, it's going to be a lifelong dream come true. And for me, I know I will continue the public speaking for as long as I live. But yes, I would love to go back to Betchako and Yellowknife and work a little bit in their hospitals just to remember where I came from, be proud, and show other people that they can do this too. I would love to give speeches to the schools in both areas. And I think that dream that, one day, nurse practitioner, open my own Indigenous healthcare practice for Indigenous people. And I believe that just inspiring that next generation. And I guess the best way I could describe it is I really look forward to what I can do, what I can become, because I believe that my life is more than myself or my family of 7, and that, other than an Indigenous registered nurse, a motivational speaker, how can we give back to the Indigenous homeless population? Because I believe life is more about myself and family and how to give back to the people in need.